New research is shedding light on how children are affected by COVID-19. A study in the journal JAMA Pediatrics finds more than 5,300 children and teenagers in 22 states were hospitalized with the disease between May and November, and some children are facing serious complications, among them inflammation. Mireya Villarreal spoke with one affected family in North Texas, where coronavirus numbers have been skyrocketing.
Full of energy and affection, you'd never guess 8-year-old Van Fuqua is bouncing back from a disease that left him struggling in a Texas hospital bed less than a month ago.
My appetite is back.
What was it like before?
Before, it was like I was mostly asleep. Like I slept like
2 naps a day.
Yeah, 2 naps a day.
His mother, Kate, tested positive for COVID-19 back in November, and the entire family quarantined as a precaution.
So we really kind of thought we dodged the bullet because I was the only one sick and nobody else had any symptoms.
But a month later, Van was hit with his own symptoms. Fatigue first, then a fever of 104 degrees, a rash on his body, strawberry tongue, and trouble walking. He tested negative for strep, the flu, and 2 COVID tests came back negative, leaving doctors scrambling to figure out what was wrong.
He had some really scary numbers on his labs, like his heart was in heart failure, his kidneys looked bad, his liver looked bad. So they were really scrambling, trying to figure out, which one of these systems is the culprit, and none of them were. It was all an inflammation reaction to the virus.
The virus was COVID, and the diagnosis was MIS-C, short for multi-system inflammatory syndrome, a relatively rare complication from COVID in children. Van is just one of more than 9,000 youth COVID cases diagnosed in Dallas County this past December, one of America's most populated.
All the trends are headed in the wrong direction. So I think it's going to be a pretty dark several weeks, if not months, as we move through this pandemic.
Dr. Jeffrey Kahn heads the infectious disease team at Children's Health Hospital in Dallas and says kids now make up 15% of Dallas County's positive cases.
How did that happen?
The virus is widespread in the community right now, and it's easily transmissible, particularly in a household setting. So if you have somebody who's COVID positive, regardless if they're symptomatic or not, if they enter a household, the people in the household are very high risk for getting infected.
More states across the country are reporting increases in pediatric COVID hospitalizations. In Utah, a 5,000% increase, Arizona, 4,000, and Wisconsin, South Dakota, Ohio, and Minnesota are all reporting a more than 1,000% increase. Dr. Kahn says that means parents should be on the lookout for signs of MIS-C, the multi-system inflammatory syndrome. It can pop up after COVID-19 is long gone.
What is so striking about this disease is that, for the most part, these are otherwise healthy children with no significant medical history who are coming in and are quite sick. Many of these children are in heart failure, require intensive care, and we're seeing more and more of this as the pandemic evolves.
An evolution being closely monitored by health officials around the country. For CBS This Morning, Mireya Villarreal, Dallas, Texas.
Parents should know that children with MIS-C may have a fever and various symptoms, including abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or just feeling extra tired. Important to point out that the CDC says not all children will have all of these same symptoms, so it's something to monitor, although rare.